Hi guys, welcome back to the channel. So in this episode, I'd like to talk about treatment plans. I've been a chiropractor now for 20 years, and initially I was employed for 2.5 years and got exposed to a certain approach back then in terms of patient management. And for the last 17.5 years, I've been basically just doing it my way. So there's two types of treatment plan out there that as far as I've seen. On one hand, there is the chiropractor such as myself who will see you as a new patient, come up with a plan of attack, and follow the classic template, which is at the start of the treatment, the chiropractor will be pretty much heavily involved because we're trying to maybe realign things, get muscles firing better, get nerves firing better. And then as you improve, we back off. So, and if it's a long-term condition, we back off, but still remain involved with what they call maintenance care. So a typical template for me might be to start off with weekly sessions and stop after maybe 4 to 6 weeks, do a review, ascertain how we're getting on, and then if appropriate, usually after 4 to 6 weeks, a patient with a long-term problem is at least 50 to 70% better. Then I start backing off. So that might include doing a couple of fortnightly sessions, and then ultimately, once things are stabilized, then, for example, if there's underlying layers that we just can't deal with, such as wear and tear, or if there's driving factors in your problem, such as desk work, then I remain involved to try and maintain the progress that we've already made. And that might be me having a consultation with you and giving you a treatment between once a month and once every 3 months, and maybe even further. But generally speaking, the average person might come in every 2 or 3 months for a little bit of maintenance. So it's very much, my approach is very much a treat, assess, treat, assess, treat, assess, retest, treat, retest, treat. Get the patient involved with exercises, and essentially with me doing my thing and you getting involved doing your exercises and being proactive and taking on advice, almost session by session, we get you back on track, and we think of the next session when we've completed the last one. Now, that's my approach, and that's a pretty common approach. There's another approach that I've seen in chiropractic over the years, and that's the approach whereby you have the initial consultation and the person, the chiropractor in this case, concludes that you need to pay for 20 to 30 sessions up front. Now, I've always had a real problem with this type of approach, because the obvious question is, well, how do you know I'm going to need 20 sessions if you haven't even started the treatment yet? How do you know how quickly I'm going to recover? How do you know whether I'll make any progress at all? So my opinion is that if someone's asking for 20 sessions up front, or if someone's not even asking you to pay for those up front, but they're just saying to you, it's day one, we haven't started treatment yet, but you need 20 sessions, you need a course of 20 sessions that will span over the next 3 months, I would personally suggest that you think carefully about that, and you think about the viability of that recommendation, because I just can't see how, like I said, you would know what someone's recovery rate would be in advance in order to make that recommendation. So basically what I'm saying is, be cautious of chiropractors that want to sign you up for a course of treatment before they've even begun. There's also the use of x-rays in chiropractic. Now, when I first graduated, I had access to an x-ray machine on site, and I would x-ray a lot of new patients. I would x-ray pretty much every single new patient over 50 just to see what state their spine was in. But then over the sort of following 3 or 4 years, I eventually got rid of the x-ray machine, because I decided actually my decision-making process when I'm diagnosing and when I'm treating you comes from what I can feel when I'm palpating your spine, and also comes from feedback that I get on functional testing, such as muscle testing for muscles, or orthopedic testing for range of movement in joints and joint alignment. So my testing on each session, as well as the feedback that I get from my hands when I actually palpate your spine, will tell me what I need to be doing, what I need to be treating, what I need to be adjusting, and what exercises you need to be doing. And I concluded after, like I said, 3, 4, 5 years that actually having a picture, an x-ray, an actual picture of your spine, didn't actually give me any additional information that I needed. So for example, very quickly my patients started to get better, and I thought to myself, well, that wasn't because I had a picture of your spine, that's because what I was able to feel and do in-house on each session. So I personally don't think receiving an x-ray up front is of any benefit at all, unless there is good reason to take it, i.e. that there would be a good chance that it would change your clinical approach to treatment. If there's not a good chance that x-ray is going to potentially change how you proceed from day one, then it probably isn't worth taking. So consequently, my approach is that I would only actually use an x-ray now if, in the odd occasion, I start treatment, the patient doesn't get better as I expect, which thankfully is rare. But in these instances, okay, we need to have a closer look just in case I'm missing something, or just in case there is a structural issue in there that actually I can't help you with. So that's my take on radiology. Just to recap, I don't believe that it should be used routinely in musculoskeletal diagnostics on day one, unless there is good reason that it's going to change your clinical decision making from then on, i.e. your treatment approach. I do think imaging is useful if the patient has failed to respond, and that's when I would use imaging myself. Okay, any questions, leave them in the comments. Don't forget to subscribe for future content. Thank you.